Hello, and thank you for attending our presentation entitled Getting Paid, Part 1, Navigating the Telemedicine Reimbursement Landscape. I'm Seth Lunan, Product Marketing Manager for Telemedicine. Our presenter for the day is Shruti Patel, General Counsel at MTBC. Video and audio usually works best through the web. If your video and audio is not working properly, the recorded presentation will be posted online after the webinar is completed. Please hold any questions until the end of the presentation. We will follow up with answers to individual questions after the webinar. I'm going to share my screen and then turn this over to Shruti. Shruti, it's over to you.
Thank you, Seth. Good afternoon, everyone. We're so excited to have you join us for part 2 of our 6-part webinar series. In case you missed it, part 1 focused on telehealth 101 and if it's a good fit for your practice. A copy of the recorded webinar is available on our website at www.mtbc.com. You'll find a link to it under our event and presentation tab. Today, I'd like to focus on the question every provider has when they're looking to make a new change in their office. How can I get reimbursed, and will I get reimbursed? Well, we're here today to talk about that and answer a lot of your questions. For a quick overview, let me say, reimbursement and payment really varies by payer and state. Today, we'll focus in on the 3 major payers: Medicare, Medicaid, and private payers. We'll start off our discussion with Medicare. To be reimbursed by Medicare, there are 5 statutory conditions that have to be met. We'll go into each condition one by one, and we'll have a little bit of more information for you. The first condition for Medicare is that the beneficiary or patient is located in a qualifying rural area. The second is that the beneficiary is located at one of the qualifying originating sites. The third is the services are provided by one of the qualified distance site practitioners who are actually eligible to furnish and receive Medicare payment for telehealth services. 4, the beneficiary and the practitioner have to communicate via an interactive audio and video telecommunication system that permits real-time communication between them. And 5, when submitting a claim, the correct CPT and HCPC codes are present on the bill so that reimbursement can occur. A rural area really is an area where health. So for Medicare, they want to be able to bring telehealth, be able to get to doctor's offices or hospitals. The second part is the originating site. Different types of sites include a physician's office, a hospital, different clinical offices. So when performing telehealth services, we have to make sure that the providers who are providing the services are actually at these types of services. The third part is to make sure that the practitioner who's providing the service is an actual distance site practitioner to be able to be eligible for reimbursement. Examples of a distance site practitioner include physicians, nurse practitioners, a physician's assistant, nurse midwives, clinical nurse specialists, clinical psychologists, and even social workers. Sometimes a registered dietitian or even nutrition professionals are eligible to engage in telehealth services and even reimbursed to Medicare. Then we'll move on to the forms of telehealth. There are 4 different types of telehealth that providers can engage in. The first is the obvious video conferencing, live video conferencing through, let's say, an iPhone or an Android, where you can actually see the patient in real time and the patient can see the physician in real time, talking to each other through the phone, real-time communication. Another form is store and forward. Store and forward includes storing the medical information on a computer and then forwarding it through means of email or fax. Another form is remote patient monitoring. Let's say you have an iWatch. You can use your iWatch to, track your steps, track how many calories you've burned. That's another form. And the fourth form is mobile health, by connecting with doctors through different apps. The good news is there's so many different forms of telehealth. The bad news is that Medicare right now only provides reimbursement for live video conferencing. And even remote patient monitoring and mobile health, there is no legislation in place. When we get over to Medicaid, you'll see that some states do even provide some type of reimbursement for store and forward. And finally, the most important part is making sure that when a bill is submitted, the proper CPT codes are visible on the super bill so that Medicare can see, okay, that this was provided. We have a webinar coming up in a few weeks about coding, which will dive deeper into the details, but there are common codes that can be put onto the super bill to ensure that providers are getting reimbursed. Two common codes are 99201 and 99202, which is just an off-site office visit. We do have some good news for Medicare. A legislation and bill was passed in April of this year that beginning in 2020, Medicare Advantage will now offer telehealth services with their basic plans. This will be good, that telehealth will be kind of a norm in the medical healthcare space, and it'll allow beneficiaries to select a plan that allows them to receive telehealth services. Another big thing is Medicare 2020 will eliminate the geographical limitation, such as the rural area, and will now provide patients with more options to places that they can receive healthcare service from, like their homes, regardless of whether they are in a rural area or not. Moving on to Medicaid. Like I mentioned, Medicare and Medicaid differ in a huge way. Medicaid is actually a lot more lenient on reimbursement and is more mandated through state legislation. As of spring of 2019, at least all 50 states and Washington, D.C. now reimburse for some type of live video telehealth services. As I mentioned before, Medicare only provides reimbursement for live video conferencing. In contrast, Medicaid provides reimbursement for store and forward, remote patient monitoring, and there's also 14 states for store and forward. Some states include Alabama, Arizona, Connecticut, California, and Georgia. For remote patient monitoring, 21 states provide reimbursement. Some examples include Colorado, Illinois, Maryland, Nebraska, and Oklahoma. For more information, you'll have to visit your state legislation to see what type of reimbursement is provided through Medicaid. Along with reimbursement for more than one type of telehealth, Medicaid also provides reimbursement of the transmission/facility fee. You ask, what's that? Some states will reimburse the cost incurred by the originating site to provide the technological means to the patient, as well as the fee that the facility incurs for providing the telehealth services. In comparison to Medicare that restricts the geographical location, Medicaid limits the type of facility where services are rendered. Additionally, 31 states require some sort of written or verbal consent from the patient to receive telehealth services. Sometimes a state Medicaid program will ask for it, and sometimes it won't. It all depends on the state. Moving on to private payers. Currently, 40 states and Washington, D.C. have laws that govern private payer reimbursement. Since spring of 2019, several states have passed new or revised private payer laws. These private payer laws require states to reimbursement to be equal to in-person coverage, but most require parity in covered services. Unlike Medicare and Medicaid, there are no restrictions on where the patients can be. Patients can be anywhere that they want to be and receive telehealth services. Also, any provider that can bill for an in-office visit can bill for a remote telemedicine encounter. There are common conditions that are served by telemedicine, and you'll see them here. This is not an exhaustive list, but these are some of the conditions that can be served. And as telemedicine and telehealth continues to grow, we believe that the conditions will actually increase as more and more providers continue to engage with telehealth. On to another question that providers have. I'm a doctor in Illinois, but my patient is in Missouri. How does that work? With any medical degree and any medical license, providers have to be licensed in the state where they are providing services. Luckily for providers, there are different ways that they can get licensed in different states. For example, there are 9 state boards that allow just for a special telemedicine license. Those states are Alabama, Louisiana, Maine, Nevada, Ohio, Oregon, Texas, and Tennessee. However, please note that Tennessee is only for osteopathic medicine. In addition to this, if you live in a state or you want to provide services in a state that doesn't provide a special license, there is the Interstate Medical Licensure Compact. It's a compact of 29 different states and Washington, D.C. that have entered into a compact where providers can get licensed for multiple states in an expedited process, and it's a one-stop shop. There are certain requirements that have to be met in order to qualify, but certain states include Maine, West Virginia, Mississippi, and Alabama. If you visit the Interstate Medical Licensure Compact website and you see that your state's not on there, don't worry. There are certain states that are in the process of implementing the compact, that include Pennsylvania and Georgia. So if you're in those states, there's good news and relief for you. You could soon enough be able to get a multi-state license to the IMLC. Also, there are states where legislation has been introduced to be part of the IMLC, such as South Carolina and New Jersey. In addition, if providers have a good eligibility tool, you'll be able to check the eligibility of your patients using that tool to see if your insurance covers telemedicine. For example, some research has been done, and it has been said that Blue Cross Blue Shield of Arizona provides reimbursement for telemedicine. Humana provides reimbursement for telemedicine. Some state-specific Blue Cross Blue Shield provide reimbursement for telemedicine. United Healthcare provides reimbursement for telemedicine. It really depends on the state you're in and the insurance that some providers have. With the growing emergence of telemedicine and telehealth, it looks like insurance companies and providers are on one path, being able to provide patients with the services that are needed, but also reimbursing the providers for the services provided. For those that joined us, here are some key takeaways from our presentation. Remember, reimbursement varies by payer and state. Additionally, no 2 states are alike in reimbursement. Massachusetts could have, reimbursement for 4 things, whereas New Jersey has reimbursement for 1 thing. Additionally, don't forget that Medicare is the most stringent, where there's 5 statutory conditions that must be met for reimbursement as compared to Medicaid and private parity laws. And providers must be licensed in the states where they wish to provide services. In order to do that, you have the tools through the 9 special state licenses, as well as the licensure compact that can help you get licensed in the state that you want to provide services. I want to thank everyone for their time. For more information, you can go to www.talkmd.com. And if you have any questions, please feel free to reach out to us. We look forward to having you join our next webinar, which will dive deeper into the coding issues that providers face during telehealth.